So today we're going back to talk to Taryn, and we're not getting into core stabilization today. We're getting into a topic that is very near to myself. It is called chronic pain. We're going to talk about how it affects all of us, how it's prevalent, and how society perceives somebody that looks perfectly fine on the outside, but does actually suffer from, let's say, some issues internally. And how we have to, as the individuals going through that, have to deal with perceptions and actuality. So we're going to take a ride. We're going to go catch up with Taryn, and her and I are going to sit down and explain to you guys how we, as professionals, help you to deal with that and to make it so that it is a lifestyle that is easy to manage. See you soon. Okay, so how's it going, guys? Like I was explaining, I'm here with Taryn, and we're going to be talking about chronic pain and how it affects the individual, and it affects the family unit, and it affects their perceptions within society. So you know me, I'm the guy that takes an individual and works from a holistic and healthy perspective in trying to make them stay active. Taryn is the professional that is working at a clinical level, that deals with this on a daily basis with multiple patients. I would send my clients to go see her to consult, and then it would come back to me and we'd put everything that she has in place in play in a plan to make them moving forward staying healthy, active, and vibrant. Mm-hmm. So this talk, I'm pretty much going to hand this over to Taryn. We're going to, bounce back and forth on ideas, but I want her to try to, explain how this is presented from the physician's point of view straight down through the individual and how it translates into the family dynamic. Mm-hmm. Do you think that that's the best approach to take on this?
Yeah, I think that's fair.
So where would you want to start with this?
So usually with my patients who are coming in, maybe they don't have like the diagnosis of chronic pain, mm-hmm. but they're certainly presenting with that. So I see a lot of like hypervigilance. So they're very descriptive in what they feel. They know what they're feeling, and they're feeling a lot of things everywhere. And it can become very mentally consuming for them. So just as a general rule, anyone with chronic pain, that's someone who's had pain for more than like 3 to 6 months. So they're transitioning into this chronicity. And what happens, the unfortunate thing with the chronic pain is that there are changes in the synapses. So we call them nociceptors. So there are pain receptors, and they're receiving input from our body. And what happens is it turns, with this chronicity, our body will receive a stimulation. And something that, like you've experienced, I'm sure, should not be what we call a noxious stimulus. Right. It'll send them through the roof. Right. So then when something that should be a noxious stimulus actually happens, that really lights them up, and then they'll have kind of like an exacerbation. So the most important thing that I try to convey to my patients is that like we've talked about, maybe some healthcare providers in their past have said, well, it's in your head. Mm-hmm. And that makes them feel like they're crazy, right? Right. It is and it isn't. So the pain they're feeling is very much so real. However, the stimulus and the amount of pain that they're feeling, they're not lining up. Right. So if someone just gently brushes you, you should not say, yeah, that's an 8 out of 10 pain. That's a problem. Right. And what's happening is that with this prolonged chronicity of the problem, the nociceptors, those pain receptors, they start to amplify that signal that's sent to the brain. Mm-hmm. So this little brushing is then interpreted and amplified. Right. And then it's amplified. And it can be amplified up to 3 to 4 times before it reaches our brain. And the interesting thing is that the longer the pain is present for, the more likely there is for our limbic system or our emotional system, our lizard brain, to be really activated during these pain receptors, instead of it being more of like our higher brain functioning to say to ourselves, geez, that was, someone just brushed me, this is crazy. Right. We're not going to call that crazy though, because pain is very real. It's very real. And right. So that brings us to, like you said, the physicians are there to help, but they are clinicians and they think at a higher level. So when they're interpreting that this is in your brain, it's in your head. Right. It's not so much that they're saying you're crazy, it's that they're trying to explain to you that this is a condition that is translating through the central nervous system and the peripheral nervous system, and it is literally in your head or in your heart. It is being amplified in the central nervous system, your spinal cord and your brain. Yeah. So if it's getting lit up there, it's literally, it's in your head. It's very much so real.
Right.
But it is being exacerbated, the condition is worsened in your brain, because like we talked about, pain is the only way our body can communicate to us that there's an issue.
Right.
And so if we don't listen, or we aren't able to heal with those initial few acute stages or subacute stages of pain, then our body says, basically, okay, stupid, now you're gonna pay attention to me because there is a problem.
Right.
And that, I mean, it's tough, because it's tough on the individual.
Right, and that's where we want to, we're here to take this, is try to help the individual put this thing into a pigeonhole that they can start to work from to make it so that they're getting better and healthier. So, you have your initial diagnosis or lack thereof, because the doctor may just say, I want you to go see a physical therapist, and they're going to give you some ideas on what we're going to do.
Right.
Once you have a kind of a concept on what's going on, so a little backstory. For me, I have complex regional pain syndrome, or RSD, and it took a while for them to diagnose that for me. I was constantly in and out of PT and different kinds of treatments, and we never really landed on the diagnosis, and it was always a frustration for me not knowing what was wrong. So when we get back to the individual, once you start to realize what is going on and where you stand in this medical arena, and you start to see professionals like Taryn to help you desensitize your body to these, you're making progress. And you as the individual, pain stimuli tells you to pull back usually, to withdraw. What I found personally and professionally working with other clients that suffer from chronic pain is that you have to be able to put it in a perspective. That pain should not be as traumatic as it feels. So therefore, it is okay to keep pushing through. As long as it's not causing acute pain or damage. The body is telling you one thing when the actual exercise or movement or stimulus is not to the level of what the body is telling you.
Right.
So this is where Taryn and I work. We work at the desensitization and re-education of the nervous system to make it so that you can continue to move forward. So can you dive a little bit more into that ideas of the desensitization?
Yeah,
and,
absolutely. So a lot of what we, sometimes it's kind of like you have to play a game inside your mind where you tell yourself, what I'm doing, pain does not equate to tissue damage. It does not always equate.
Right.
And if, like you mentioned, the acute pain, if you have a pop or a snap and there's a sharp pain, yeah, that's probably an issue.
Right.
But if you're just having regular joint noise, that's normal.
Right.
And if you start moving or exercising, and you start to have some generalized kind of diffuse dull pain, okay, that's okay. The literature with chronic pain tells us that, we want to, if our pain threshold is here, we want to get up to it. Maybe, surpass it a little bit, ride it, and then come out of it.
Right.
And what that constant pressure on our pain threshold starts to do is tell our body, hey, look, we're hitting it and everything's okay. We didn't fall apart. So then our brain starts to relax a little bit and it will increase that pain threshold. We liken it to like a little dog. It doesn't know if there's an intruder coming to rob and kill you, or if it's a mailman dropping off mail. It's gonna bark, 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 whatever stimulus there is. Okay. So we have to calm that little dog down.
I like it. That's a great analogy.
Yeah.
I love it. So now we're gonna take this into the next part of this, where we talk about how does the family unit deal with a diagnosis like this and a re-education process. Personally, I can tell you that it was tough. Especially when you have little kids running around.
Yeah.
They don't understand why mom or dad are just hurting and they're trying to play, but it's really hard for them.
Yeah. From
my side of the coin, my recommendations would be to desensitize.
Yeah.
Continue. Right. Get up. Get moving. Enjoy your family. You may not be comfortable with it, but as Taryn explained, the more you do this, the more re-education you do to the peripheral and central nervous system, the easier those moments are going to become, and the more enjoyable they will become as time goes on.
Yeah.
It took me a couple of years once I was diagnosed with this crazy condition to actually get back to normal. But the reason why her and I both felt that this was a great topic to cover, especially this time of the year, is I see an influx in aches and pains and let's say clinical diagnosis is kicking back in a little more in the fall. And I can tell you from experience, I'm going through it myself. So the idea is not to slow down. That's why I thought this was a great topic for us to cover. It's to push through, because once you make it through the other side, you will not have a regress, you will have progress. And what do you think?
Yeah, I mean, as the wife of somebody who's been dealing with chronic pain, it can be very trying. And I think the most important thing, you know, there have been times where we've had what I like to call come to Jesus moments where, you know, it's like, hey, I know you're hurting, but I need you.
Right.
And communication is what really, like getting personal, communication is really what saves the marriage, is that you need to be able to have those real tough conversations with your people. Maybe it's your spouse, maybe it's, you know, a parent, maybe it's a friend, but you need to have somebody who you can connect to on that level and have those real conversations with, so that you can move together forward.
I agree. Taryn, we covered so much into this topic that I'm sorry this is a 10-minute long video, but it is something that I feel, and I believe you as well, is important that the information gets out there. Having gone through it, having experienced this, knowing what the weather is like out there right, coming up, it is critical that you stay moving. That is the final takeaway from this. We understand you're hurting. Make sure that you're not causing any more damage and causing acute pain. But if you're not, and the sensations that you're feeling are significantly greater than they should be, then you need to desensitize yourself and keep moving forward for yourself, for your family, and for your overall well-being. And at any point, obviously, professionals, we're here to help and guide you guys. So obviously, Taryn's information will be at the end of this video. Reach out to her. You know, you can always reach out to me on any of the social medias, and I will give you as much guidance as I can and refer you to somebody that can truly help you succeed. So on that note, we will talk to you guys in a few weeks, and I hope you guys have a